for the first question, can long run bad deep sleep pattern affect my BP over time? I think this was kind of addressed earlier, right?
Yeah, so it does. And Singapore, unfortunately, is a chronically sleep-deprived society. Everyone works way too hard and doesn't prioritize their sleep. And if your sleep is poor quality and you don't get enough of it, what happens is that your adrenaline and your cortisol levels start to increase in the early morning. And the next day, it's well recognized that your blood pressure is higher. So if you're a chronic poor sleeper and you have high blood pressure, if you focus on your sleep, then you can actually change some of the blood pressure issues that you've got.
Great. There's very good reiteration of the points that you covered just now as well. Okay, can we go on to the next question? Is there any best time to take medication, amlodipine, morning after food or night before bed?
This is quite an individualized question. There's no right answer to this. And actually, it's the kind of question that you need to ask your doctor, because every patient is slightly different as to when they need to take their medication.
Okay, good. Next question. So this is a slightly longer question. So my insurance clients are always telling me that they don't want to take up insurance when offered exclusions on their applications. They will try to reverse their high blood pressure first. From my experience, there's no one that could actually do that successfully. Any comments about this?
Okay, so when we see people in the clinic that are diagnosed with high blood pressure, there's a certain group of them. The ones that have what we call grade 1 hypertension, and that's when their blood pressure is between 140 to 160, and their diastolic blood pressure is 80 to 90. Sometimes we'll actually give them time to try and lower their blood pressure with lifestyle. Some people can reverse their high blood pressure. Not everyone, and if your blood pressure is really high at the start, it's very unlikely you'll be able to completely reverse it. But if you are overweight, if you're sedentary, you have a terrible diet, and you have lots of things in your lifestyle that you can fix, then potentially you can reverse it. And classically, the patients that we see reversing their blood pressure are the ones that are overweight. So if you're 10 or 15 kilos overweight and you get your weight down to normal, which is achievable in 6 months or so, then you can reverse your high blood pressure. So it is possible, but it requires a lot of dedication, and you have to really focus on your lifestyle, and not everyone is able to do that much focused lifestyle intervention.
Definitely. Yeah, but as you said also, if no one wants to take drugs, then exercise is kind of the best drug for high blood pressure as well, and heart disease. Yeah. Okay, so next question. Okay, so this is a slightly different question. How do I make the decision on whether to stent multiple coronary blockages versus having bypass surgery?
It's a very common question. Basically, there's a few different things that we look at when we see a patient. The first one is it a single blockage or multiple blockages? Does the patient have diabetes? Does the patient have heart failure? What age are they? And often you'll find that it's the pattern of disease that's important. So if a blockage affects the nearest part of the arteries at the top of the heart, often a bypass is more appropriate. But it's actually individualized to the patient, to be honest with you. So some patients who are diabetic with lots of blockages will generally always go for a bypass. Some patients that are younger that just have a single lesion will just go for a stent. But it is variable, and part of it depends also on what the patient wants. So we have that discussion.
Understood. Yeah, so I guess it's really about getting personalized consultation and advice on your own risk factors and your own condition as well, right?
Yeah, exactly.
Okay, next question. So this is a question for women. Is a menopausal woman more prone to heart disease?
So it's a really good question, because women are protected from heart disease before the menopause. Their estrogen makes them much less likely to have cardiovascular disease. However, after menopause, they tend to catch up in the risk with men. So women, they're not completely protected throughout their lives. They tend to get cardiovascular disease about 10 years later than men. And one of the interesting things recently has come out is that if you have an early menopause, then you have to start thinking about your heart disease risk a bit earlier than other women that have had a later menopause.
Understood. So we will still have to put in effort to actually control all our risk factors as well. Kindly explain about the respiratory arrest and pulmonary cardiac arrest in a simple way. I think one of our registrants have this question.
Okay, so basically this is a cardiorespiratory arrest. You've got your lungs, which get oxygen into the blood, and then you've got your heart, which pumps the blood around the body. A respiratory arrest is when something stops your lungs getting oxygen into them. So an example might be somebody chokes on an apple and they are unable to breathe, unable to get oxygen into their system, and they collapse because they're not getting enough oxygen to their brain and the rest of their body. That's a respiratory arrest. A cardiac arrest is the other part of the system that goes wrong. So if you have a heart attack, and then that triggers a very fast heart rhythm, that means your heart is unable to beat, then the cardiac side of the system fails. The heart no longer is able to pump blood and you collapse. So it's just, the arrest part is that your cardiorespiratory system is no longer able to function and your body collapses. And it can be either driven by the breathing portion or the heart portion.
Great. That's a good answer. I hope the person that asked this question is actually here to listen to it for themselves. So why do I experience palpitations when I feel agitated and then I can't breathe normally after? Is it a sign of a heart problem?
It's a good question. I mean, it could potentially be a heart problem. Palpitations are quite non-specific sign. It's the feeling of an abnormal heartbeat. Sometimes that can just be little extra beats. Sometimes actually your heartbeat can be completely normal and you can feel palpitations. So if you're in any doubt, it's always worth getting seen by a cardiologist, to, at the very least, get an ECG. And what we normally do when people get palpitations is we fit a heart monitor for maybe 1 or 2 days to actually record the ECG to see exactly what's going on.
Nice. Okay. The next question. What will happen if your blood pressure rises up to 260 over 190 once you're in a closed area and you still do not experience any symptoms, but once you are in an open area, it falls down to 120 over 80? Is it dangerous?
It's quite
basically extremes of the blood pressure.
So it's difficult to answer that completely with regards to the areas, but basically blood pressure naturally goes up and down. Okay, we regularly stress people in our office, and we put them on the treadmills and we see them go from blood pressures of 110 over 60 at the baseline, and regularly we'll see blood pressures going up to 200 and 220, and that's actually the normal response to stress and exercise.
Wow.
If you're weightlifting, your blood pressure can go up even higher, but usually short-term little bursts of high blood pressure are not unsafe. 260 over 190 is an incredibly high blood pressure, and I'd have to ask the question if that was actually an accurate pressure reading. It's very unusual to get a diastolic pressure of 190, so that'd be my first question, would be, is it actually a true reading or not?
Understood. That's a very good consideration to have for everyone as well, if they are actually monitoring their blood pressure right as well. Yeah. Okay, so next question would be, hi, Dr. Michael, how do we solve an enlarged heart? Can it be restored to a normal heart size after some food intake, or must things be done?
So often we'll see, so enlarged heart, we usually call heart failure. And heart failure can come back to normal with the correct drug treatment, usually. Sometimes we also see people that have an enlarged heart on a chest x-ray, and that's not really an enlarged heart. Classically, the referral we get is chest x-ray shows enlarged heart. So what we do then is we do an ultrasound, and that ultrasound allows us to see exactly how big your heart is. And from there, we can determine if you have an enlarged heart. So if you've been told you have an enlarged heart on a chest x-ray, the first step is actually to get a cardiac ultrasound or an echocardiogram to see if it's enlarged. That's
a very good answer as well. So go to the next step to just confirm the enlarged heart. Yeah. Great. Okay, another question. Is digital BP reading really inferior in monitoring BP compared to the manual way of measuring BP?
No, it's not. The modern digital meters are incredibly accurate. Sometimes they can struggle though. So if you've got a normal, regular heartbeat called sinus rhythm, digital blood pressure monitors are excellent. But some people have got an irregular heartbeat, and digital monitors can struggle a little bit if you've got an irregular heartbeat. So often a manual monitor can be more accurate in people with irregular heartbeats. But for most people, 95% of people, the digital devices are perfect. They're dead simple to use, and manual devices for most people are actually quite difficult to use.
Yeah, I remember the olden times where they will have to count as well and keep the watch in check. Yeah,
That's
so
right.
it's like a lot of multitasking going on.
Exactly.
Okay, yeah, so there's another question. I have low blood pressure, but I love salt and processed foods. I also don't exercise or sleep much. Is there a chance I'll get high BP if the doctors tell me I have low BP right now? From Charlotte.
Yes. So basically, some people have very low blood pressure, and particularly women, when they're younger, often have very low blood pressure. But you know what? Over time, we all get older, and age is one of the biggest risk factors for having higher blood pressure. And if you put on weight and don't exercise, then potentially you could get high blood pressure in the future. Not everyone does, but if you really try your hardest to develop all the risk factors, then potentially you could get high blood pressure.
Right. I guess we are not immune to aging in that
Yeah,
sense.
exactly.
Okay, someone asked, what is the acceptable heart rate during exercise, like walking, for a hypertensive individual on a maintenance drug?
So again, this is very much comes down to the individual patient. So we set different targets based on what is wrong with the patient and if they've got any other conditions. But in general, resting heart rate should be less than 70. Your walking heart rate should probably be less than 100, and
Right.
depending on how fast you're walking. And actually, there's no specific heart rate that we try and target for high blood pressure patients. The most important thing is actually their blood pressure control rather than their heart rate control.
It's true. Okay. Does a normal EKG or ECG indicate normal blood pressure?
No, so the ECG doesn't relate to your blood pressure in most people. So your ECG is basically the electrical signal of the heart. And in every patient with high blood pressure, we always check an ECG because we can sometimes see changes in the ECG that might indicate the patient's got changes in their heart due to high blood pressure. But just because you've got a normal ECG does not mean you've got a normal blood pressure. They're very much independent.
Great, good info to have. Okay, if somebody has unstable angina, what would be the best exercise to suggest? Does this person need to be referred to cardiac rehab?
Yeah, so first of all, if someone has unstable angina, we generally advise them not to exercise because it suggests they've got an unstable blockage in their heart arteries. So normally we would recommend they were treated first, usually with medication, but often with a stent or a balloon angioplasty. And once they were treated and they were stable, then we often will recommend some cardiac rehab initially. And cardiac rehab, for those that don't know, is basically, it's a supervised and structured program of exercise and education that we offer to lots of our heart patients. And it's been shown time and time again that if you're a heart patient and you enter a cardiac rehabilitation program, you do much better in the longer term. You have less mortality, and you tend to get back to fitness much quicker as well. So if you've got unstable angina, don't exercise. See a doctor first.
Yeah, that's very good advice. Okay, next. Is it necessary that if someone has white coat hypertension, the doctor has to increase the dose of the antihypertensive drug?
So this is a really good question, and actually it's very topical. So for those that don't know, white coat hypertension is when somebody goes to see a doctor and their blood pressure goes up. And it's really, really common. People get stressed when they go in to see a GP or they go in to see their specialist. and their blood pressure naturally goes up. So we never treat and diagnose blood pressure based on just one reading. We always look at multiple readings before we make the diagnosis. And in fact, if someone's got what we think is white coat hypertension, often we'll ask them to take measurements of their own at home, or we'll fit a 24-hour blood pressure monitor to get the correct diagnosis first. And often people with white coat hypertension actually don't need any medication at all.
Understood. Yeah. Okay, I think we have one question from Facebook Live. Okay, so the question is it okay to exercise if you have an enlarged heart instead of unstable angina? If you have an enlarged heart, is it safe to exercise?
So again, this is the term enlarged heart is quite non-specific. It's not really a medical condition. If you have heart failure, we do recommend some exercise. What I would say is if you have any concerns like this, if you have an enlarged heart or heart failure or angina or coronary artery disease, actually it's best to talk to your cardiologist, because we often individualize what each patient is able to do and what our recommendations are.
Great. Okay. One question about how to take your blood pressure accurately. Is it true that I must have both feet planted on the floor when I take my blood pressure?
Yeah, so how you take your blood pressure is really important. And this is the advice that we give people. So you should be sitting down and you should have both feet on the floor and your arms should be resting at the side. You should be sitting for 5 minutes and you should be relaxed and not talking. And you should take your blood pressure at that point. You really have to be the most relaxed you can be, because what we actually want to know is what is your blood pressure at your most relaxed. Because as soon as you do things like talking or stressing or you're rushing around, your blood pressure naturally is going to be higher. But we want to know what your lowest blood pressure is, which is why it's important to be super relaxed and sitting down for about 5 minutes before you take it.
Nice. I've also heard that you probably would have to go to the toilet first to empty your bladder or something before you take your
exactly. So
blood pressure.
if you need to go to the toilet, your blood pressure is definitely going to be up.
All right. Okay. Next, is acid reflux connected to heart problems? Acid reflux.
Acid reflux. So acid reflux is when the acid in the stomach can end up coming up into the esophagus and causing kind of acid burning. It can be related to heart problems. And one of the most common relationships is that if you're on heart medication, some of them can cause or worsen reflux.
Understand. Okay, next one will be when someone is in a supine position and snores loudly, continuously turn him sideways. But if he doesn't stop snoring, what is an advice that you have?
So if someone is a loud snorer, the first thing I would say is they probably need assessed for sleep apnea. Okay, and that's when a device is fitted at home and it assesses their breathing throughout their sleep. Often you'll find that when people are supine, their snoring is a lot worse. And when they roll onto their side, their snoring is not that bad. There are ways that you can try and optimize your sleeping position so you're not spending time lying on your back. But manually adjusting the person you're sleeping with is probably not ideal for your own sleep. So I'd probably advise the patient to have a sleep apnea test first.
Right. Yeah, especially when you say that sleep apnea causes increase in high blood pressure.
Yeah.
Okay. Another question. Are there negative long-term side effects to taking high blood pressure medications, or are the medications rather safe today?
So the medications that we use are very safe, and they've all been tested in clinical trials against placebos. And we know that the benefits of taking high blood pressure medication far outweigh any small risks. High blood pressure medication, if you control your blood pressure, you prevent strokes and heart attacks and all these terrible conditions that are related to high blood pressure. There are some side effects with some of these tablets. Common side effects are a dry cough with ACE inhibitors, or swelling of the ankles with calcium antagonists. But there's no long-term significant side effects of taking high blood pressure. There's far more long-term side effects of having untreated high blood pressure.
Oh yeah, that's a very valid point right there, to actually treat the untreated high blood pressure. Okay, this question is probably from a medical professional, but they say some patients are concerned about the low BP that they have, but they are asymptomatic. How do you assure the patients that having low BP is not a large problem or a big problem?
Yeah, that's the key thing, isn't it? It's about being asymptomatic. So I always tell people that that basically having low blood pressure is essentially protecting their arteries. And if they have low blood pressure, they're far less likely to develop cardiovascular disease in the future.
Mm.
And having low blood pressure is not an issue at all if you have no symptoms at all. And in fact, when we treat some heart conditions, we will bring their patient's blood pressure down to 80/60. And we're not that bothered about it as long as the patient is actually not having dizzy spells and falling over. So yeah, low blood pressure is not an issue if you feel okay.
Good to hear. Okay, there's another question here. For the local food available in Singapore, can you recommend what will be in line with the Mediterranean diet? Any practical advice?
It's really difficult. So I have this discussion all the time with people that spend a lot of time eating out, because we all love to eat out and there's so much good food here.
Yeah.
The difficult thing when you eat out is that often the food is processed and it's full of salt. And so it's trying to make the correct choices. So it's trying to pick the food that's got more kind of unprocessed vegetables in it and less kind of processed meat, and less sauces that might contain lots of salt. It's difficult. And ideally, in most situations, it's actually cooking food yourself at home rather than buying it out. And it's trying to choose things that are fresher, that are less prepared with less sauces. It's probably a simple way to look at things. But it's tricky.
Yeah, especially the more affordable options are usually slightly oilier, slightly more saucy as well, especially for the options that you can find in the hawker centers, because they taste good and oil and fat taste good and salt.
Yeah, exactly.
Yeah. All right. Okay, I think let's just do a few more questions, maybe 2 or 3 more questions. Can overexhaustion cause cardiac arrest during sleep?
I think that's unlikely. Cardiac arrests during sleep in older people are usually caused by undiagnosed coronary artery disease and heart attacks. Cardiac arrests during sleep in younger people can often be undiagnosed arrhythmia problems. So it's unlikely that exhaustion is a problem unless the patient actually has something that's kind of undiagnosed, which is relatively rare.
Right, understood. Okay, I think let's just do for one last question. Does blood pressure rise naturally after a meal?
It can do. It can go up, and actually it can go down after some meals as well. When you eat, you divert a lot of your blood supply to your gut, and you get constriction of the peripheries. So it's a variable response. If you overeat, then you may well get a high blood pressure response. And it depends what you eat as well. If you eat a lot of salt in a meal, then you may get an increase in your blood pressure after a meal too.
Right. Okay, I think I just have one last question, because I think this is a very relevant question for everyone out there. Is there an age where you recommend checking for heart disease?
Yeah, there is. So for people that have no family history and no other problems like high blood pressure or cholesterol, then from the age of 40 onwards, ideally you want to be checking for heart disease. If you've got any risk factors, so if you've got a family history of heart disease, you've got diabetes, you've got high blood pressure, high cholesterol, you should be checked for heart disease at a younger age. And when I say check for heart disease, actually the most important things that we all get checked are blood pressure, cholesterol, glucose, and watching your weight. The 4 things that I've said before. If you want to do the simplest things that have got the most kind of bang for the buck, is getting your cholesterol checked, getting your glucose checked, and getting your blood pressure checked.
Yeah, and I believe all those can be done with like a yearly annual checkup, either of your company or just by going over to the polyclinic or nearby clinic as well to do it.
And actually, I'd probably add to that. So what we're starting to see now is we have a very sedentary population that doesn't do a lot of exercise. And actually, I'd say that if you are considering, if you're over the age of 35, 40 and considering starting an exercise program, we now recommend that people get a stress test, an exercise stress test
Wow.
before they start, because we want to try and pick up undiagnosed coronary disease in these people as well.
Wow, yeah. And then where sudden stress or exercise will actually like trigger their coronary heart disease.
It does. I mean, you see these tragic cases of people going out jogging and then dropping dead from a heart attack, and that's usually due to undiagnosed coronary artery disease.
Right. Okay. Wow. Okay. So thank you everyone for actually such an engaging session. I myself have learned a lot of valuable information from this live Q&A session myself. So there are actually still many good questions that we are unfortunately unable to answer due to the lack of time. However, we will be collating these questions and answering them with the help of Dr. McDonald and posting it on our website as articles. So do follow our Facebook page to keep yourselves updated. Yeah, so I believe I learned a lot about early checks, early diagnosis, ensuring that when I check my blood pressure, is it actually accurate reading actually about it as well. Yeah. We'll be also putting all these questions which have been answered on our by Dr. McDonald and releasing them as videos on Medical Channel Asia's social pages. So if you have not subscribed to them, please do so now. You can find the links in the chat. Also, do keep a lookout for our post-event email, where you can also continue to sign up for the links, and we'll keep you updated with the subsequent events that will be happening. If you'd like to arrange an appointment with Dr. McDonald to have your condition assessed, simply drop him an email or WhatsApp his clinic, and he will contact you shortly. The clinic will contact you shortly to arrange. So before we all go, do click on our MCA channels for the latest updates on our subsequent Doctor on Call events and webinars. So thank you once again, Dr. McDonald. Thank you for your precious time on this Tuesday evening. And thank you everyone for attending, and may everyone have a good night.
Thank you, Champagne, and thank you to everyone for attending.
Thank you so much. Bye-bye.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.